Dr. Choll Kim here from sunny San Diego, California. We're about to start my favorite surgery, the laser endoscopic spine surgery, also called LES, on this 69-year-old from Pauma Valley, which is a beautiful golf resort, but they don't golf. In any case, here is the lateral or sagittal MRI looking sideways with the discs separating these bones. They're like Coke cans stacked on top of each other, separated by the shock absorbing discs. This is where all the nerves live in the canal. This is all the back. This is the front. And then this picture is the bologna slice cross section. So here's 4-5, which is relatively normal. You can see the canal and the little dots of the nerve, and here's the disc. Here are all these powerful back muscles that we're trying to preserve. Here's the little facet joints. We're trying to preserve that too. And you can see there's plenty of room in the canal, but when you scroll down to L5S1 right here, you can see that little protuberance right there. It looks like a rock in your shoe. That's a disc herniation. And if you look at the cross-sectional image here, watch when I scroll down, this yellow line moves. That's the canal again. And when you get down to that disc protrusion, look at that shadow right there. It is filling up the right side of the canal, pinching the S1 nerve root. So she's not gotten better with non-operative treatment, so we're going to go in there with the most minimally invasive technique that I have, the LES procedure. So I want to avoid detaching the tendon. I want to avoid injuring these muscles. I want to avoid resecting too much of this facet joint, which is what we do when we perform a microdiscectomy. So we'll make a poke hole, sneak our way down here like this with the endoscope, and then just by wanding back and forth, I can take that disc herniation out without detaching the tendon, crushing the muscle, or removing any of the facet joint. And then I can put a little Band-Aid on there, and that'll allow her to get back to life really, really quickly with very little post-operative pain. So wish me luck. All right, looks like they're almost ready for me. The blue team is gathering everything up. We have everything but the kitchen sink in here. Anesthesiologist, neuromonitoring technician, radiology technician extraordinaire, physician's assistant extraordinaire, and my right-hand woman, and the most awesome surgical tech on the entire planet. And then all the way from Utah, my man on the laser. So you can see how much support I need to do the surgery, because the smaller the incision, the more help I need. It's like an inverse relationship, but I love it because I love people, and I love these people like they're family. Getting started, I found the perfect entry point through a combination of intraoperative imaging, anatomic localization, and the force, Luke, the force. Shot. This is a tight space. There's very little disc material in there. Look at that vacuum phenomenon. And then here's the chromatodiscogram. Shot and save. Shot and save. We should see a big leak out the back. So you can see a little line that goes like this. Shot and save. You can see a blush behind it too. Shot and save. Alrighty, so I'm looking laterally toward me. It's upside down and backwards. You can already see the blue. That's where the disc herniation is, but that's also where I went in, so it's not totally fair. That's blue. Now I'm looking medially, that's toward the canal where the nerves are. And I'm going to just rotate this endoscope to reveal the canal, and there's the disc herniation. It may just squirt out like a hot pimple too, which is oddly gratifying if I have to say so myself. So you'll see me using every piece of equipment, including the cannula, to help me get the job done. Okay, so just cleaning things up. I already see the drill tube right there. It is so close to the disc herniation, but then again, that's what spine surgery is all about. And you know, my mom always said spine surgery would be way easier without blood vessels and nerves. But this is going to be awesome. Top layer is the ligamentum flavum. You can tell she's had epidural steroid injections, those little white spots. The blue is the disc herniation. And then look right between the yellow ligament and the blue dye. There's like a little strip of tissue with a little vein in it. That's the drill tube right there. And that disc herniation is right here. And I'm going to persuade that sucker to move away from the drill tube and toward me. By being really nice and gentle and caressing it lovingly. because this cannula has an angle on it. It's beveled. So I can use the tongue as a dissector. So I'm going to just nudge the drill tube over the top of that disc protrusion. If it'll cooperate, that is. And this is one of the reasons why the nerve can get irritated after surgery. You're touching it. That happens no matter how you do the surgery, but when you do it open, you have a lot more room to maneuver. And the nerves have a place to go as you nudge them over. When you do it minimally-invasively like this, there's no room until you get the herniation out, because you've left all the other structures intact. That's the catch-22 of MIS. You can see the drill tube right there now. It's much more mobile. Oh, whatever, Nikki. You can really see the drill tube now. It's still covered in a thin layer of epidural tissue. It's normally really easy to expose it because it's slick and slippery, allowing all the tissues to slide by each other. It has lots of anti-adhesion molecules called glycosaminoglycans. But when there's lots of inflammation, it gets scarred down. That's called epidural fibrosis. And part of the surgery is just that, an epidural fibrosis surgery. There it is. Look at how close everything is. I have my favorite tooth terrier real quick. Ball tip feeler. We call this the Viagra. Don't ask me why, we just do, okay? But it's a curved ball tip probe that allows me to do this and be oh so gentle. Yep, it's completely stuck right there. Oh yes. Really see the drill tube now. It's still got a layer of epidural fibrosis, but look how red and irritated it is. But see how it's pulsating now? Kind of creepy, I know. But I get pimple popping maneuver. I better get that little blood vessel before it starts bleeding and I can't see. I'm gonna fall for that old trick. You can never see these tiny little blood vessels in regular surgery. Only with magnification and continuous irrigation like underwater surgery. I have to be really careful because there's an electrical instrument, and even though you can't see the nerve, it's an electrical instrument. It's electricity, and it can conduct through tissue, water, and metal. So that's where the laser comes in. When I'm too close, look at that kakapupa right there. Look how awesome it is, though. Cannot do this surgery without this instrument called the trigger flex. I could probably do it without the laser, but I have to have this. I'll cancel the surgery if I don't have this. But I think I would cancel the surgery if I didn't have the laser either. And it's a mechanical instrument. It's not electrical, so it will not conduct. The only way I can hurt the nerve with the laser is to be right on the nerve. And that's why I use the blue dye, because sometimes the annulus, which is white, looks like a nerve, which is also white. And endoscopic surgery exists in a two-dimensional universe, but we live in a three-dimensional world. So you can see why it'd be confusing, and you can see why a lot of surgeons don't like this surgery, because it is confusing as hell, even to this day. After 1,000 cases or more, I try very hard to make absolutely sure I know exactly where I am in three-dimensional space, even though the endoscope is a two-dimensional view. So my brain is like recreating a three-dimensional world despite living in a two-dimensional universe right now. We have Adam, but there's one thing that the new laser tech is better than Adam at, and Adam is the best. He's much better telling me to blink. Because I guess I forget to blink sometimes. So Adam's the one that first noticed. He's like, Dr. Kim, do you notice you haven't blinked in like 5 minutes? I'm like, no wonder my eyes are burning. So I guess he told that to the new rep when he left. And now the new rep is better than Adam. Okay, so I am between the drill tube and the disc herniation using this articulating instrument that we call the salt and pepper because it's a downgoing pusher. I didn't name it, but I love the name. And if you know salt and pepper, you know why we call it that. If this is a pusher. This is like that game in the arcade where you have to go down and grab a toy with using that remote hook. What's the name of that? Claw machine, yeah. Or it's like bobbing for apples. So awkward sometimes. But hey, if it was easy, everyone could do it. A claw from Toy Story. Oh, so frustrating. Now, aren't you glad I used the blue dye now? Because literally, the drill tube is right there. And it's shocking how similar it looks. There it is right there. Look at that. Ooh. Thank you, Nikki. We're just testing you, making sure you're paying attention over there. Okay, I'm almost done. There's a little bit left over. There's the drill tube right there. Look at that. You see that? And I have it pushed over. Look at that. Oh, so gently though. There's the other side. I'm going to get that with the laser. I've tried it with everything else. And that's why I changed my mind now. I will not do this case without the laser because that is so hard to get out with a mechanical instrument. It's very possible that I don't even need to take it out, but no one knows. So in the absence of certainty, do a little bit more. It's called a mistake of commission than omission. It's not a law, but it's a generally good rule in surgery. And that's my personality. I'd rather just do a little bit too much than too little. Look at that now. There's actually a cavity where the disc herniation was. And then look at the drill tube, how it just moves back over. And I bet you'll start pulsating. Like that. It's like a cat purring. I love it. Because I'm a cat guy. All right, and we just do a little bit of cleanup, making sure that everything's free and not stuck down the ball tip feeler, the Viagra. Check for any bleeding, and then I should be done. Then I can do the mic drop and feel very proud as long as you get better afterwards. Look at how irritated everything is. You poor thing. If anybody says you're acting like a wimp, show them this video so you can go like, look at what I was dealing with all those years. Oh, I'm just looking around. I'm gonna probably get a left hand cramp soon. Surgery's all done. We did it through that little poke hole. It's like a vampire bite, but with like a vampire with only one fang. It's adorable. It went beautifully. And I get to put this cute little Band-Aid on there. We call this the most expensive Band-Aid in the world because it probably is. And we're all praying for a great result and a speedy recovery. Right, guys? Yeah! Woo!